Good evening, everyone. What's going on, everybody? This is Dr. Bashara Wilson with New York Sports Acupuncture. Welcome again. Today, we're going to continue talking about acupuncture and the science of acupuncture. And actually, we're going to do a deep dive in terms of my particular style of acupuncture, sports medicine, acupuncture, specializing in musculoskeletal conditions and how I address that in my private practice. Probably very similar to how some other practitioners, but I use a whole bunch of different therapies because most people's conditions are usually pretty chronic. They've had it for a long time, and we need to do many different things in order to address it and for it to stay addressed. When we look at Western medicine, is usually like for like pain management, is oftentimes a shot, like a steroid shot of some sort that can relieve the pain. Um, but for some folks, they may get 2 or 3 steroid shots in a year, and the body has to detox from those chemicals that are injected in the body. And for some people, it doesn't work. And they're still in pain, and pain can be very debilitating in so many different ways. It can affect the mind in terms of how frustrating it is to always be in pain, not be able to do certain things. Daily activities of living for women might be hard for them to reach across and just put on their bra, or for a parent with young children to be able to pick up their children and enjoy their childhood in that way, or just being able to walk down the street or sit down for a while without pain, or standing up for a while without pain, or any of those sorts of things. And so with musculoskeletal issues, that's my specialty, because just from my youth participating in competitive sports, I know how it is to have pain and have the body not be able to respond and react in the way that I would want to perform my best, whether in a competition or even just in everyday practice or play, whether that was basketball, wrestling, track, any of those things, especially too when you get to around different competitions that I may have wanted to do, and having an injury and having to push through and doing well, but also knowing that if I didn't have that injury, I could have done even better. And so as we get older, other things may set in, like arthritis. I think about different aches and pains that I may have that come from different things that might have happened 30 years ago in my teens, little bumps and bruises, injuries, what have you, that are starting to kick in now. And I'm sure some of you can relate to it. Folks have been in car accidents. Sometimes the type of work that folks do put them in awkward sort of positions, like construction workers may oftentimes be twisted sideways doing this sort of motion with a screwdriver, or banging with a drill, and different things, or even our everyday office work, sitting down and just sitting at a desk. And I find, even for myself, I have to adjust and correct my posture. It can be at the desk and be kind of hunched over and typing on the computer, and the shoulders are all up. Um, Sometimes when I look at people's posture, their head will be forward because they're all literally all into the computer. You can even notice a lot of folks, if you're on the line at the supermarket, or even just walking down the street and folks are just standing up, you can see how so many people with their posture is off, and that posture and how the body is working to rebalance from that can lead to all sorts of injuries, whether you're talking about shoulder pain, um, pain radiating down the arm into the hands, with like cramping in the hands, or with carpal tunnel, pain from the lower back, that sciatic pain radiating down the back of the leg or the side of the leg into the buttocks, or down the leg into the knees, or into the ankle, or any of these sorts of things. And so one doesn't necessarily have to be athletic or an athlete or anything like that, obviously, to have injuries. And so we address all of that in my private practice. So the way that most folks are trained around coming in for treatment is with Western medicine, is most people come in after they're already injured. We're trained to go to the doctor if you're sick or if you're hurt, but there are many different things that you can do where we can look at your posture and we can look at other aspects of your health, because we take your whole body composition and your whole body constitution into account when we're setting up a treatment plan. Um, the the state of all of your different organs in your body, your internal organs, whether it's your digestion and how that's functioning, your sleeping habits, your energy level for women with their menstrual cycle, um, elimination, all of these sorts of things play a role in actually how you recover from injury. And so let's just start. So when someone comes into the office, usually someone comes in with a chief complaint, some sort of injury. So it's back pain. So we may want to know, when did it start? Is it something that just happened? Can you tell me exactly what happened? Sometimes somebody's been in pain for years, 2, 3, 5, 10 years. One client recently just retired. And right after he retired, all of his back pain and different things that he might have been feeling all the time, but that have just pushed through going to work, now sitting home, is really feeling those back pain and how that injury. And so we're working on them with that. So someone may come in with back pain. Is the pain sharp? Is the pain dull? On a scale of 0 to 10, what makes the pain better? What makes it worse? Some people, it's okay during and then it gets worse over the course of the day. Some people wake up with pain, and as they get moving, the pain gets better. Right now in New York, it's starting to get cold out. And around this time of the year, the cold and the damp, people feel it in their bones. And there's certain type of injuries that are actually set off with cold, where someone else's injury may be to inflammation with swelling. And so there are all sorts of different ways that we're looking at someone's injury. The next thing I would do is go through your bodies, all your different health systems. Like I was just discussing, whether someone gets, headache, lightheaded, dizziness, the state of your vision, your hearing, your nasal, and your basically HEENT, head, eyes, ears, nose, and throat. Then may ask about your breathing and your chest and any heart palpitations, the how much energy you have or don't have, your body temperature. Do you get hot easily, cold easily? We'll go into your diet. We'll go into how often you eliminate, and all sorts of things, your body from your head to your toe. And that creates your basic body constitution. And so with an acupuncture treatment, we're not just treating the pain that you may be coming in, we're treating your whole body, because you are whole. And that's what we're dealing with when we talk about holistic medicine. We're treating the entire person. So after we do all that, I may look at your tongue and your pulse. When I'm looking at your tongue, I'm looking at the color of your tongue, the size of your tongue, the moisture on your tongue, the coating on your tongue, where there might be any cracks. And that gives an idea of what's going on in the body, because each part of the tongue in Eastern medicine relates to a different part of your body. It's actually a mirror of your torso. So like the tip of your tongue relates to your heart, right behind that to your lungs, the sides of your tongue to the liver, the middle part to your spleen and your stomach, and the root of your tongue in the back relates to like your kidneys and your intestines. And based off of moisture, the coat or lack of a coat, the color of the tongue, the size of the tongue in each of these areas of the body, along with the different questions that we ask, give us even more of an idea of what's going on. With that too, I'll feel the pulse. And I'm feeling for the strength of the pulse, the speed of the pulse, of the qualities of the pulse, And so Excuse me. And so with that, that all provides a Eastern medicine diagnosis along with your main complaint. And like I say, the large majority of people that come to me for musculoskeletal conditions. And so from there, we already asked about, the nature of the pain. We went through the body. Next, I'll take a look at your posture. I have like an electronic posture grid where we'll take a picture of your posture from the front, the side, the back, and the other side. And from there, we can see where anything may be off. With sometimes someone's head may be cocked to the side a little bit. The head may be forward or the head may be back. One shoulder might be higher than the other. One shoulder might be forward. The hips may be tilted in. Person may be leaning to one side. The knees may be rotated in or rotated out, or knock-kneed or pigeon-toed, as folks say. The ankle, someone may have a flat foot, and so all of these things point to what's going on in the body. And so with the posture, it's a great way to see what's going on within the body, and we treat the body according to the posture. Oftentimes, I'll have someone with chronic back pain and their head is forward, their neck is forward. Once we begin to balance out the neck, how all of the muscles are all connected, everything in the body can start to balance out. Or if the hip is off and the shoulder, we have to adjust the whole body, not just the area that's hurt, because that area where you're feeling the injury may be the branch of what's going on and not necessarily the root of what's going on. And it may be the root too, but we want to address the entire body, because you're not just your back or just your neck or your shoulder, you're your entire body. And so to treat you effectively and to have long-term health, we have to take all of these things into account. So once we do all that, the posture, we'll do some other tests that you may do. Orthopedic neurological exam where we'll test the strength of different muscles, and all of that also gives an idea of what's going on. And these are some of the tests that are used traditionally by a physical therapist or chiropractor or osteopathic doctor or physiotherapist, anybody that's doing any sort of physical work. These are like standard tests. So from there, taking all of that into account, we then create a treatment plan around acupuncture. Now let's get into the meat and the bones of how I treat people in my practice when someone comes in. So we'll do some acupuncture locally, which is, when I say locally, that may be right in the area where there may be pain. So with the back, oftentimes lower back pain can be coming from a slip disc, or it can be coming from different spasms of the small muscles that are in the back and also the larger muscles in the back. And that spasm or that disc can be pressing on the nerve and send that radiating pain down down into the legs or in the buttocks, or all the way down to the knees or the ankle, or just be local right to the back. And so with it, I'm also, when I'm treating people, I'm not, like I say, this isn't just here, point and shoot. It hurts here, stick it here. No, we're dealing with the science of acupuncture. And when we're dealing with that, we're dealing with the different acupuncture meridians that flow all throughout your body, just like electricity flows all throughout your house. And you want to get to the root of what's going on. And so, say with the back pain, to stay on this example, there are a few meridians in the back, two specifically, that we usually treat for the back. There's one that runs directly up and down the spine from the top of your head all the way to the root, right up under your, right in your crotch area. And then there's another meridian, we say the Tai Yang foot urinary bladder meridian, which relates to the urinary bladder, but we're just right now necessarily talking about the energetics of it. That channel starts in the corner of your eye here. It runs over the top of your head, down your back, It splits into two meridians on each side of the back, goes all the way down the back, over the buttocks, down the back of the leg, over the calf, and ends on the corner of the pinky toe. And so we can use points along that whole pathway to treat issues along that whole pathway. So on the bladder meridian, in addition to doing local points that are just in the muscles in the lower back on both sides of the spine, in those thick muscles in your back, I may also do do points in the buttock area, behind the leg. One of the main points that we treat lower back pain is actually in the crease behind your knee, and points behind your calf muscle, on your ankle, or even going down to your toes. And won't necessarily do all of those points, may pick and choose by actually palpating, feeling the points. And points will be tender on the body. Even if you just kind of squeeze around your body, on your arms or behind your legs, you may find that the point behind your knee may be kind of tender. Or for some folks, it may be hard and stiff, where fluids and blood and different things has accumulated there and stiffened. And that pain behind your knee, um, which is slowing down the circulation of your body's chi and blood, may actually be what's going on in terms of the back pain. And in order to relieve the back pain, we need to get the chi flowing along the whole meridian. If you feel on the outside of your ankle, right below your ankle, and push in there, that might be kind of tender. And so all of these give us an insight of what's going on inside of the body. Once I do the acupuncture, I'll for 99% of my patients, I'm using electric stimulation. Well, I'll put small electrodes. Where is it? It's not in arm's reach right now, but I do some some clips on the side of the needle, on the needle, which is, and then I have a little electric machine. You turn that on to like 1 hertz or 2 hertz or 15 hertz. And when I talk about hertz, electric frequency, these are actually the same electric frequency of your body. And so the electric frequency of the machine is outputting an electric frequency, which is literally the same as your body. And as the body receives that electric frequency through the needle into the muscle, oftentimes it'll cause the muscle to fasciculate. It'll cause it to beat, where the muscle will just be going like that. Some of you, if you ever got into an accident or something, you have a TENS machine where they put the sticky patch. You've seen that on athletes, and they put the machine and it'll make the muscle jump, where this is actually going on the acupuncture needle deep into the muscle. Where the TENS is just on the surface of the skin, this goes exactly to the muscle that we're targeting. And with that, the muscle contracting and relaxing, contracting and relaxing, contracting and relaxing, causes the muscle to to relax ultimately, because oftentimes when we have pain, the muscle is in spasm. Um, Many of you have had like a Charlie horse before in your arm, or woken up in the middle of the night with a Charlie horse muscle spasm in your leg or something like that. Used to get those when I was younger after like a long wrestling tournament, wake up in the middle of the night with a crazy muscle spasm. I'm sure my wrestlers and other athletes can relate to me. Terrible feeling. Um, but that muscle spasm can be in the neck. Sometimes you have a crook in your neck or your shoulder, feel like you're holding the weight of the world on your shoulders. It's that muscle in that spasm. And so with that contracting and relaxing, it helps the muscles to relax overall. That frequency also causes the muscle to, or causes the body to release different types of endorphins. Your endorphins are those feel good molecules, but endorphins, in addition to making you feel good, are your natural pain relievers. And with different frequencies, whether you're talking about 2 hertz or 15 hertz or 30 hertz or 100 hertz, each of those different frequencies causes the body to release different types of pain-killing endorphins. And so some of these endorphins last for a short period of time for like almost like immediate relief. And then some of them are like almost like slow release where they cause the body, it kicks in later, but it provides relief for a longer term purpose. I mean, a longer term, just for a longer term. And when the body is in pain, it's difficult for the body to heal as well as it can, because when the body's in pain, the fight or flight mechanism is activated. So with the release of the endorphins, it's a natural painkiller. So instead of taking your NSAIDs, your steroidal, I forgot the rest. Sorry, just mental block, whatever. But your NSAIDs, and the different things, Tylenol, ibuprofen, or all of these different things. This is your body's natural painkillers. It also helps people to relax. And so one of the things when people are getting acupuncture with this electric stimulation, oftentimes when I just let somebody relax, I have my nice cool out music playing, and people oftentimes fall asleep and be snoring in here. And so we'll leave the acupuncture needles in for about 20 minutes or so, maybe longer, a half hour or longer, depending on how long someone's in the office. And so while they're laying down, I also use an infrared heat lamp. It's a special, like a medical heat lamp. So relaxing. Kind of like that red heat if you go to 7-Eleven that keeps the hot dogs warm or whatever. That same, but different, same sort of thing. We use that to help to warm the area, because one of the things that we need to do is to help bring more blood circulation to an area that has pain. Yeah, we want to bring more blood circulation to the area that has pain, because the blood is what's going to bring those healing nutrients to the area, and also going to carry waste and things that are away to the area. I think about the heat lamp like cooking beans. When you cook beans, it's all, melted and soupy. And then when you put the beans in the refrigerator, what happens? They become stiff. The body can be the same way when you have an injury or pain or just stiffness, literal stiffness. That area can be stiff. And so one of the ways that we help to warm the area, like you put a pot of beans on the stove to heat it up, and then it melts back down and you have your soup, we use the heat lamp to deeply penetrate into that area. I had one patient years ago who had terrible knee pain. Um, they had knee pain, but it was like terrible when it was cold outside this time of the year. And so we would do some acupuncture and they would get better. But with the weather outside, they were cold and it was just frustrating mentally, and all of the different things that can go along with pain. So one day, after doing many treatments, I was just like, you know what? I'm going to bake the knee. So I put the infrared heat lamp real close to the knee, and it can get warm, and I have to constantly be checking with my clients, and people will tell me to make sure that the heat isn't too warm and uncomfortable. And I had this thing really close to her knee, not in the way that it would burn, but I kept checking. You okay? Yeah, I'm good. This feels good. A couple minutes later, you feel? Yeah, I feel great. And so I let them sit like that. I let her sit like that for about a half hour, 40 minutes with the acupuncture, the electric stimulation, the heat. And that heat really penetrated. And after that, that was the turning point within that treatment plan. And they still had like a little bit of pain, but that really took it over the edge to promote the healing, because that cold was really settled in there. Sometimes you can feel that cold all the way down to your bones. That's how that cold can get into the bones. And in Western medicine, that can sometimes be called like rheumatism and things like that. So with the electric stimulation, acupuncture, and the heat, we'll do that. After the 20 minutes or half hour, however long is done, we'll turn the machine off, take all of the electrodes off, um, take out all the needles, turn off the heat lamp, and next I'm going to do some massage. I'm doing what's called Tui Na acupressure massage. And so with that, with any musculoskeletal issues, we want to get in there and really help to smooth out the muscles, because the muscles should be smooth, and that's how the muscles are able to contract and relax, contract and relax. When you have a spasm, the muscle is just kind of stuck together like this and not moving. And so instead of contracting and relaxing like this, you're getting this sort of motion where it's doing this. So with the electric stimulation, it helps to reset the muscle. And then with the massage, we want to get in and really work to, massage that area, get in, say this is the lower back. We may get in there with the fingers. I may do some rolling on it. Sometimes I get the whole arm and the elbow, the hands, different things to really help the blood, just like kneading it and really helping the chi, the body's vital energy and the blood get to that area and circulate and loosen up those muscles. And the body's amazing ability to heal itself kicks in, and those treatments hold. So usually a course of treatment is around 10 visits. I recommend that people come in at the least once a week. If you can come in twice or even 3 times a week in the beginning, because acupuncture works with an accumulation of treatments, especially in the beginning. Someone may come in, say they come in today, and we're filming this on a Tuesday. They may feel great. And by like Friday or Saturday, they may in the beginning feel that pain start to come back. If I see you on the next Tuesday, you're kind of back to ground zero, and now we are chasing it. But if I see you on Tuesday, and then or Monday or Tuesday, and then see you on Saturday, now we're catching it. And after a few visits and different exercises and things that I give you at home to do, all of these things begin to work together, and you feel better relatively quickly. And so, usually recommend people do around 10 visits, depending on how long something has been going on. It can take longer or shorter. And with some of the research, the scientific research that's been done with acupuncture, it's shown that when, with research, when they'll check to see how someone is feeling, then they'll check in with those folks 6 months later, a year later. They're still feeling the benefits, as opposed to some like pain relieving drugs. Once you start taking the painkiller, the pain comes right back, because the area didn't actually get fixed. Where this is like an organic physical medicine that's going in, like the acupuncture needles are almost like micro scalpels that are going in to slightly irritate the area. And when we slightly irritate the area, it stimulates a healing response. And your body gets to the point where now, boom, you don't need to come in twice a week or 3 times a week. We can get it to maybe when you're coming once a week for a few more sessions. And then we may get it to where it's like, okay, when you start to feel something kicking in again, you might come in for 2 or 3 visits. So yeah, that's pretty much it in terms of what we do in the office. Also give people corrective exercises. We discuss when the posture is off. In addition to what we do in the office, there are different exercises that we do that help to balance out if that neck is to the side, or the shoulder is up, or the hip is forward, or the knees, or the ankle, or the lower back, whatever posture might be off. There are different things that you can do, which are similar to like yoga poses, kind of, or qigong, or if you've been to physical therapy, very similar, and really a lot of the same exercises that you may get at physical therapy. But these are addressing your condition from your posture assessment. So they're personalized, looking at what it is. And then, of course, I send you a copy of your posture. And so that is pretty much it, what we do in the office. I'll give you some different herbs that you can also take that can also help with neck pain and back pain and shoulder pain. Certain herbs traditionally go or are known to go to specific areas. There's some herbs that go to the lower back, or go to the knees, or go to the neck and the shoulders. That's a conversation for another time. Stay tuned. But yeah, that is about it with that. Does anyone have any questions? Thank you to all my folks on Instagram. So, see this person right here. Bang Nabs said, "Hi, I just watched this live. I do acupuncture too at my college, traditional medicine." Cool. So one of my colleagues here, Bang Nabs, thanks for tuning in. All right. Anyone have any questions or comments on Instagram? No? All right. So let's see here. So here is my private practice, New York Sports Acupuncture. You can reach me at NewYorkSportsAcupuncture.com or NYSportsACU.com. They both go to my website. My practice, I'm here in Brooklyn on the Bushwick Bed-Stuy border. And also I'm available for telemedicine. So folks that want to call in and get an evaluation around pain, and also with telemedicine, and even in my private practice, I'm able to help folks with other different health conditions, even through consultation with herbs, with change in diet and change in lifestyle. We can do a full consultation. I have a lot of different programs around detox and purifying the body. I know as we come off of these holidays, just had Thanksgiving, and then now we're going to be going to Christmas and Kwanzaa and New Year and Hanukkah and all the other holidays that are in December, where people kind of eat a whole lot. And then, folks going into the new year, of course, with that New Year's resolution around losing weight. I have a 3-week, 21-day purification program that helps with where you can eat the whole time, but there's some great things to like cleanse the body and to help in that way. So give me a call at 888-375-5444. If you have any questions about that, or if you're interested in that, or send me a private message if you're on Instagram or Facebook or LinkedIn. You can we can tune in there and begin a discussion and see what we can do to get you on a treatment plan for different conditions. And you can also check me out at manifestherbs.com. Herbs is actually what brought me into this medicine in the first place. People always ask, how'd you get into acupuncture? I got into acupuncture because I was actually interested in herbal medicine. And the school that I went to, I just couldn't take herbs by itself. And so still love herbs, pretty much drink herbs dang near every day. And herbs are that forgotten food. We'll talk about that more. But you can also go, like I say, on my website, manifestherbs.com. I have different things there for all conditions in the body. And if you're looking again for a more personalized plan, you can send me a message in my inbox and we can go from there. So let's see. Any comments? Thank you, Yasmin Muhammad. I appreciate your support all the time. I appreciate you too, and appreciate you letting me work and help you and your family to achieve your health goals. Thanks for tuning in also. All right. If that is it, then we will shut this down and say thank you all for tuning in. I'll look again. Any comments or questions? Nope. All right. Thanks, folks. And I will see you next time. Peace.